So you've finished your ADHD assessment and you've gotten a diagnosis, and now you're thinking, should I consider medication? My name is Dr. Basra and I'm the medical director at Diverse Diagnostics, and I'm here to discuss a little bit about medication to give you some understanding around it. So with ADHD, there is guidance as to what medication should be considered. People often ask, what medication is used? The first line that is recommended for adults is a stimulant medication, and that is recommended by NICE and national guidance. It's very safe and very effective. In terms of how the medication works, it really does target the ADHD symptoms. It helps improve those symptoms of focus, concentration, that lack of energy, that restlessness, or that poor impulsivity where you make those sudden decisions which aren't necessarily good for you. One of the key things about stimulant medication, and research backs this, is it's very, very effective, and the efficacy for treatment is about 85%. So what that means is when your ADHD symptoms are under control, it results in an improvement in the quality of life that you have. In terms of how you get started with this process, medication at Diverse Diagnostics is prescribed with safety in mind. Our medication is prescribed by clinical ADHD specialists. What you do is you book in for a medication and initiation appointment, but we do some really important checks in advance. One of the checks that we request is a GP medical summary. So we look at your old medical records to make sure that we're not missing any previous health condition. We also want to know what medications you're currently taking and the ones that you have previously taken. We also would request physical observations, and this is to ensure that the medication is safe for you. Once you have had your medication initiation appointment, you would be followed up every 4 weeks. And the reviews happen every 4 weeks to ensure that we can titrate up the dose until your ADHD symptoms are well managed. Once you're on a stable dose for stimulant medication, you only need to be reviewed once every 6 months. In terms of prescribing, we offer shared care with your GP if your GP agrees, or we offer private prescriptions if that is something that helps. I know many of you will find the process at the beginning a little bit overwhelming, and you may have a lot of questions. At Diverse Diagnostics, we're here to support you every step of the way. Please don't hesitate to reach out to us via phone or email, or you may speak to our aftercare coordinator who can discuss our treatment options with yourself.